which is not used in heart failure. Which of the drugs, right? So option A was metoprolol, option B was trimetazidine, option C sacubitril, option D nesiritide. So we will see the individual drugs and we will come to the conclusion that which one of these is not used in heart failure and why. So I will first talk about nesiritide. See, nesiritide is a BNP analog, right? Nesiritide is a BNP analog which is approved for treatment of resistant pulmonary edema associated with acute congestive heart failure, right? Pulmonary edema plus heart failure. Right? So this is used in heart failure because nesiritide is a BNP analog. BNP is brain natriuretic peptide analog, right? So it is a BNP analog and it is used in pulmonary edema plus heart failure, right? So this option is correct, means it is used, right? Next I will talk about sacubitril. So sacubitril is a neutral endopeptidase inhibitor. What I wrote as NE is neutral endopeptidase inhibitor, and it is approved for treatment of chronic congestive heart failure, right? Chronic, I am writing CH, chronic congestive heart failure. CHF is chronic congestive heart failure, right? So, and sacubitril is used along with valsartan, right? This combination is used. So this is also an option which is correct, that it is used in heart failure, right? Now I will talk about metoprolol, right? So as you know, this is a beta blocker, and specifically saying it is a cardioselective beta blocker. So beta blockers like metoprolol, then bisoprolol, carvedilol, nebivolol, these are used in chronic CHF, that you know, right? Chronic congestive heart failure, these are used, right? So the only option that remains here is this one, option B. So this is your answer. This drug is not the first choice, right? So now I will discuss about trimetazidine, right? I will take a fresh page. Yes. So see, what is there in trimetazidine that you should know is that it is a PFOX inhibitor. So what is PFOX? It is a partial fatty acid oxidase, right? PFOX is partial fatty acid oxidase inhibitor. So it thereby, it inhibits free fatty acid oxidation, as in the name it suggests, right? It inhibits free fatty acid oxidation in heart. So the ATP is compromised. Now heart has to compensate this ATP generation by increasing glycolysis, because fatty acid oxidation has been inhibited, right? I am writing it here so that you don't mess up things. See, fatty acid oxidation is gone, right? This drug inhibits fatty acid oxidation. So what happens? ATP is decreased. Now heart has to compensate for this decreased ATP, right, by increasing glycolysis, right? So glycolysis, so in this process actually there is decreased myocardial oxygen demand in this process, which results in ischemia, right? So, and also there are other side effects of this drug like agranulocytosis, then thrombocytopenia is another side effect associated. Then it can increase the risk of movement disorders like Parkinson's disease. So for all these causes, this drug is a second line choice for stable angina. Second line choice, right? And it is not that used in heart failure, right? I will not use this drug, I will not prefer this drug in heart failure because all these associated conditions, right? So the answer for this question remains trimetazidine. So trimetazidine is not used in heart failure. Remaining all other options are used. So I will revise this topic again for you. The question was, which is not used in heart failure, right? This was your question. Which one of these is one second. Yes. So your question was, which one of this is not used in heart failure? So in options it was metoprolol, trimetazidine, sacubitril, nesiritide. So nesiritide is a BNP analog and it is used in condition of pulmonary edema with acute heart failure. So definitely nesiritide is used in heart failure. Sacubitril is a neutral endopeptidase inhibitor. It is used in chronic congestive heart failure. The combination that is used is sacubitril plus valsartan. So definitely it is used in heart failure. Metoprolol is a beta blocker and is used in heart failure, you know. Now the option that remains is trimetazidine, and which is your answer, because trimetazidine is your partial fatty acid oxidase inhibitor. It inhibits fatty acid oxidation, thereby decreases ATP, thereby decreases oxygen demand and causes ischemia along with agranulocytosis, thrombocytopenia, Parkinson's disease. So for all these associated conditions, I will not prefer trimetazidine as a treatment of heart failure, right? So that was your explanation.